Hello, everyone, and welcome to PAMA's and FSA's OSHA Standard and What You Need to Know webinar. Today's webinar is brought to you by the Professional Awning Manufacturers Association Division and the Fabric Structures Association. I'm Mike Gaddy with Herculite Products, current PAMA chairman. We are here to welcome you all and especially to welcome and introduce our speaker today. You will have an opportunity to submit questions to today's presenter by typing them into the question box on the control panel. You may send in your questions at any time during the presentation. We will collect these, and they will be addressed during the Q&A session at the end of the presentation. I would like to introduce today's presenter, Peter Coos. Peter is an industrial hygienist for the Minnesota Department of Labor and Industry with 19 years experience with OSHA and 6 years experience with the Minnesota Department of Health. Prior to his role, Peter spent 6 years with the Minnesota Department of Health and 4 years as a high school science teacher. Peter received his Bachelor of Arts degree in chemistry, biology, and education from
McAllister.
McAllister College. Please welcome Peter.
Thanks. I'm a consultant. I work for the state of Minnesota. My job is to help you make your facility healthier and safer. Now, each state has their own consultation unit. So if you want help with your health and safety programs or you need some kind of air and noise sampling, contact your state and it's their job to help you with this. Everything that they do is free and it's confidential. Okay. Today I'm talking about Silica, and this is a presentation that I've given many times. I have taken this presentation and customized it for your industry. Okay, this is a rule that was published on March 25th, 2016. That means that this is law and everyone in the United States needs to be following these rules right now. Some of the reasons for the rules is that the old rules were not very good. They're hard to understand. The construction permissible exposure levels in particular were in units that were an obsolete particle count per cubic foot, which honestly I don't even know how to measure, and that the permissible exposure levels were pretty high. In general industry, the permissible exposure level was 100 micrograms per cubic meter. That's 100 millionth of a gram. And the construction was about 250 micrograms per cubic meter. So for some reason, construction was 5 times or 2.5 times higher than general industry. Well, anyways, but the most important reason for changing the rules is that it didn't adequately protect the workers. We know that silica is bad. It causes silicosis, causes lung cancer, causes COPD, kidney disease, and we know that exposure to silica at levels even below the 100 micrograms per cubic meter is bad. What I want to impress upon you is that silica is nothing more than the main component in glass. And so respirable silica is little shards of glass. And so anytime that you're breathing in silica, you're breathing in little shards of glass, which is not that much different than breathing in little pieces of asbestos. And so my advice to all of you, whether it be at work or at home, is keep your exposure to this stuff as little as you can. You know, it's not hard to protect yourself from this stuff. Filtering face piece respirators do a great job. And those are those little paper ones with 2 straps that you can buy at any box store or any lumber yard for $1 or $2 a piece. So do a great job, use them. The health benefits of the new rules is that it's estimated that it'll save 600 people a year from dying from lung cancer, silicosis, and other diseases that are caused by silicose, that are caused by exposure to silica. So that's the primary reason for the rules, is that the health benefits to yourselves and to your employees. The new permissible exposure levels are 50 micrograms per cubic meter, and there's an action level of 25 micrograms per cubic meter. And what the action level really means is that if you have levels above the action level, if you measure them or you think that your employees are going to have exposure in excess of that action level, then these rules apply to you. Okay, scope of the coverage. Whenever you look at OSHA rules, it always talks about the scope of the coverage, and what that really means is that what does it cover, and who does it cover, and what kind of procedures does it cover. The stuff that's highlighted in red are some of the 18 different processes that are covered under the Silica standard, and it spells out that the type of silica that we are worried most about is quartz, cristobalite, and tridymite. The rules are actually broken up into 2 parts. One of them is a general industry standard, and that one applies to anyone that's working indoors, mostly in manufacturing, making stuff, like for you guys would be awnings or anything that goes on inside besides construction on the inside. And that there's another standard that applies to people working outside in the construction industry, and that would be for the people that are actually installing the awnings. Now, the 2 standards are almost identical in every way. The only difference between the 2 is that for construction work outside, you need to have a competent person that's like a supervisor that knows what's going on. And the one for the outside, the construction, actually has a table in which they have different procedures and requirements for respirators that have already been thought out for you, so you don't actually have to figure the stuff out. So a lot of the legwork has been done by federal OSHA and NIOSH to figure out what people's exposure would be doing certain tasks. And in the table, it has the tasks listed, procedures, and what kind of respirators you should be using at the time. Anyway, so we'll get back to the table in a little bit here. The standard is laid out in this manner. It's a very standard way for OSHA standards to be constructed. Nothing special there. For construction, and actually for general industry too, what we worry about is that we want to keep people's exposure to less than 25 micrograms as an 8-hour time-weighted average. If you do not have exposures that are 25 micrograms or above, this standard actually doesn't apply. Okay, so when can you expect to be below 25? Now, what I'm about to read to you is guidance that comes from the the OSHA Small Entity Compliance Guide for Respirable Crystalline Silica Standards for Construction. Now, this is a guide that's published by federal OSHA that's available to you. These aren't the rules, but it's a guide from federal OSHA. Basically, what the guide says is that if you are drilling with a handheld drill for 15 minutes or less, your exposure to silica will be less than 25 micrograms per cubic meter for an 8-hour time-weighted average. It also spells out mixing concrete for post holes, pouring concrete for footers, slabs, walls, or removing framework. All those tasks, you can expect exposures to be less than 25 micrograms per cubic meter, and this standard doesn't apply to you. It also says that there might be other tasks. So even though the guide says that mixing concrete for post holes, if you're mixing concrete for a 2 foot by 2 foot slab that you're going to pour to support an awning, it's pretty much the same as mixing concrete for post holes. What you don't want to do with this is take a look at the drilling with a handheld drill for 15 minutes and say, well, you know, if I cut with a circular saw and a masonry blade for 15 minutes, I should be okay. Now that's something totally different, and the standard would apply for something like that. Anyhow, in construction, if you take a look at the rules, they have table 1 that matches 18 different specific tasks with effective dust control methods and sometimes respirator requirements. What they have done in this table is that they have gone out and sampled. They have figured out what people's exposures would be during a certain task and put all this stuff in a table so that you don't have to do it. You know, if you don't like the table, you can go ahead and sample your employees yourself and determine their exposure. And we'll talk about that in a minute too here. But anyways, here's an example of the table. And what I did is I took 2 of the 18 different tasks that are listed in the table and put them on a screen here for you. Basically, these are the ones that I think that your employees will be participating in the most. The first one is handheld or stand-mounted drills, including impact and rotary hammer drills. So on the left side, it has the equipment task listed. In the center, it tells you what kind of tools that you want to use and what kind of work, practice, and engineering controls you need to use in order for those tools to be effective. And so if we take a look at the handheld drill, it says use drills equipped with commercially available shroud or cowling with a dust collection system, operate and maintain the tools in accordance with manufacturer's instructions to minimize dust emissions, and the dust collectors must provide the airflow recommended by the tool manufacturer and have a filter with 99% or greater efficiency and a filter cleaning mechanism. So it tells you what kind of tools you need to use, and it tells you to follow the manufacturer's directions on how to use the tools. Now that is really important because that's what OSHA enforcement is going to look at when they show up at your site. If you have a drill that's equipped with a dust collection system, they're going to make sure that that dust collection system is operating and that it's operating with the right airflow and that you have a filter on it and that the filter has 99% or greater efficiency. So be really careful with that. On the right side of the table, it tells you what kind of respiratory protection you need to have. and it says minimum APF, that's minimum protection factor. And as you can see that if you're using a drill for less than 4 hours or greater than 4 hours, you don't need to use a respirator. Okay, let's take a look at a different one. Handheld power saws, blades any diameter. That'd be like a skill saw with a masonry bit on it. Use the saws with an integrated water delivery system that continually feeds water to the blade. That basically means that you need to have some kind of water reservoir or water supply hooked up to the saw and have it operating whilst the blade is spinning. So literally you're cutting wet. And again, you have to operate the tool in accordance with the manufacturer's instructions. And in this example, they break it out into using it indoors or if you're using it outdoors. If you're using it at outdoors for less than 4 hours, you don't need to use a respirator. Your exposure is going to be less than 25 micrograms per cubic meter. If you do it for greater than 4 hours, then you need to use a respirator to protect yourselves from the silica. If you're using it indoors, it doesn't matter how long you're using it, you need to use a respirator. Okay, here's a list of the 18 different procedures or tasks that are listed in Table 1. And I have highlighted in red the ones that I think might be pertinent to your industry. Not everything in the world is listed there. If you have something that's not listed, there are options of which we'll talk about in just a minute here. Like I mentioned earlier, this is really important. The presence of, just using the right types of tools is not enough. You got to make sure that the tools are maintained properly and that they're functioning properly. Which employees are covered? The employees that are actually engaged in the task when operating the equipment are the operator of the piece of equipment and anyone that's helping that person with the task. So if you have a second person there that's holding something while the first person is drilling through it, that person would be engaged in a task and they are covered. People aren't engaged in a task if they're just working there on the site and doing other things. So you have a helper that's actually going to the truck and bringing stuff back and forth and setting things up, and that helper is not actively engaged in a task. You don't have to worry about them. You worry about the person that's actually operating the tool. Okay, Table 1 talks about the use of respirators. Basically, the employees need to use the respirators when they're engaged in the task. So if you have somebody that's got a circular saw that's cutting on concrete for a half hour, they need to wear that respirator for the half hour that they're actually cutting. Once they stop cutting, they can take off the respirator. All right, there are some other methods other than Table 1 to determine employees' exposure and whether you need to use respirators or not. The two options are there's a performance option and there's a monitoring option. And basically what the performance option is that there is data out there that comes from manufacturers. Sometimes it comes from other entities that have actually tested their equipment or tested certain processes to determine what an employee's exposure would be doing a certain task. Okay, so if you can come up with data that shows that what your employees are doing has an exposure less than 25 micrograms per cubic meter, that's great. What this performance option is it allows you to do that, but you have to show it. The manufacturers manufacturers of tools have actually done a lot of this. So if you go on various tool manufacturers websites, and I did this yesterday, and I check on a bunch of tools. They tell you that of course their tool is the best, and that they have done sampling and doing certain tasks, and they have to determine that this tool is really safe, that the exposure to silica is such and such for someone operating the tool. What you want to be careful with in that situation when you're using that data from a manufacturer is that the data actually pertains to what you do. To give you an example, I saw data on a hole saw, and the manufacturer sampled employees while they were drilling holes in the ceiling that was made of concrete. Okay, so that's where the data came from, drilling holes in the ceiling. Now you can't, if you think of a drill with a little cup around the outside and you're drilling a hole in the ceiling, as you're drilling a hole in the ceiling, all that silica and all that dust from that hole is going to fall into the cup. Now, if you take that drill and turn it sideways and start drilling into a wall, or point it down and drill it into a floor, that data is not going to work. So be sure if you're using objective data that you're actually using the data that reflects what you are doing. And then there's always a scheduled monitoring option. You can go ahead and do the monitoring yourself. And as an industrial hygienist, I do this all the time. I do it with sampling pumps, and the sampling pumps are hooked up to a cyclone, which spins the air around in a circle. The heaviest silica falls out, and the really fine silica gets collected on something that resembles a coffee filter. You can do that, or you can hire somebody to do that, and you can find what your employee's exposure is. If you don't want to do that, you can use table 1. But that's something that can be done. You can contact your local consultation unit. They can do it for you. I've been doing that in the state of Minnesota for about a year for various construction people and general industry people. But basically what that allows you to do is that you do your own sampling for the task that you are involved with, and then you determine your own employee's exposure. And then based on those results, you may have to resample in 3 months, or you may need to resample in 6 months, or you may not need to resample at all. But one caveat to this is that if you change your process or you change tools, then you need to reassess, your employee's exposure. All right. OSHA rules with the methods of compliance with silica. OSHA changed the rule so that you can use any engineering or work practice controls to limit your employees' exposure to the silica. In other OSHA rules, they do not allow you to use work practice controls. Now, work practice controls basically are employee rotation. That that exposure to silica is bad, and so that this allows you to rotate employees through rather than have one employee do it all the time. And also, in this set of rules, it actually spells out that respirators are needed in certain types of activities. Okay, here's some examples of some engineering controls that are available. Take a look at left side. There's somebody that's cutting block with a chop saw without any engineering controls. Notice the dust that this employee is exposed to. I can guarantee you, if you see a cloud of dust like that, that's really bad. The exposure to silica in a cloud of dust like that, generally a couple minutes and you're over the permissible exposure level. So when OSHA enforcement is driving by and they see something like that, I can guarantee you they're going to stop. My advice to you is, if whatever you're doing, if you're at home cutting paver blocks or cutting some concrete at home, and you're putting up a cloud of silica dust like that, that's a bad cloud of silica dust. That's an overexposure in just a couple of minutes. If you take a look on the right side there, there's somebody cutting blocks using the water control method. You notice that you just don't see anything, and that's because the exposure to silica is really, really low because the process is being wetted, and the silica is actually in the water and ends up on the ground. Same example with jackhammering. Person on the left jackhammering. No engineering controls. Person on the right is jackhammering with a water spray to control the dust. Okay, some of the engineering controls that I have seen out there for your industry. I know that you guys mostly drill holes in walls and blocks and stuff to set up attachment points for the stuff that you sell. But anyways, there's vacuum attachments that go on the drills. There's ways to wet the blade. There are wetting attachments to wet the drill bit. There's shrouds that go around the drill bit. There's some dust extraction equipment that you can use, and they make special bits so that you can keep the silica dust to a minimum. If you're interested in these things, just get on your favorite website of your tool manufacturer and see what they have that can help you out. Respiratory protection is required under certain circumstances, and this is my way of basically reminding you that if you require your employees to wear respirators or you allow them to wear respirators, you have to have a written respiratory protection program. And the written protection program has to have certain things in there, such as fit testing and employee training and fitting and teaching them how to don respirators and doff respirators and things of that sort. So don't forget that one. Housekeeping. This is one that people indoors are having a real difficult time with, that you don't want to stir up the silica by dry sweeping it or brushing it or using compressed air to blow off the surfaces or your clothing or anything of that sort. You want to do whatever possible to keep the stuff from getting back into the air. I mean, you can dry sweep and brush and use compressed air if you can show that there are no other methods that you can use. And quite frankly, that'll be very, very difficult to use, very difficult to do. Commonly, what's used are HEPA vacuums. Those are high efficiency particulate accumulator vacuums that take out 99% of the small particles. You can use wet sweeping. There's sweeping compounds that are damp that you can spread around to keep the silica from getting into the air. So Those are things that are commonly used in the industry. Or you can wet it down. You can hose it off. Need to have a written control plan, an exposure control plan. And basically, this is a document that covers these tasks and these things that you need to do. The exposure control plan must list the tasks that you are involved with in which the employees will have exposure to silica. Along with those tasks, you list what engineering controls you're using to control that silica, what work practice controls you need to use, and what respirators you're going to use for that task. You also list the housekeeping measures, how you're going to keep the silica from getting back into the air. And if you have high levels of silica, what are you going to do to restrict other people from getting into that area? You know, how are you going to keep people out? Okay, this written control plan, there's plenty of them available. If you punch into your internet search engine, exposure control plan, silica control plan, they're not real complicated. I mean, you can get 50-page ones if you want. I suggest you if you put together a 3 or 4-page one that lists the things that are listed on the screen here, something that's easy to read, easy to understand. You do not need to write the whole silica construction standard and put it into your control plan. Your control plan is designed so that people can easily take a look at it and know what to do. You need to have a competent person, and that's somebody that's designated to implement the written exposure control plan. It could be a supervisor, could be an office person, it could be somebody on site at the time of the construction. But the competent person has to be able to identify the silica hazards and has authority to do something about it if something is going wrong. Doesn't have to be on the site at all times. It can be somebody that frequents the site. So if you have many crews and you have one supervisor that's a competent person, that's fine. As long as that competent person is actually visiting the site and ensuring that the processes and the procedures are being followed to control the silica. All right. If you have situations where your employee has to wear a respirator because their exposure to silica is too high, it's either from either the monitoring data that you put together or from table 1 that they need to use a respirator for 30 days or more, you have to offer your employees medical surveillance, which basically means you send them off to a medical facility. They will do a physical exam, chest x-ray, pulmonary function test, and a TB test on an initial exam only. So in other words, they're going to check out your employee to make sure that they're in physically good condition and they're not suffering ill health effects from exposure to silica. The medical facility will issue a detailed medical opinion or finding, and that will go to the employee. Okay, so all the detailed stuff will go to the employee. What you will get as an employer is you will get a recommendation on whether or not the employee can wear a respirator, limitations on exposure to respirable silica, and whether they need to see a specialist or not. Okay, as with anything in OSHA, you need to do training, and you need to do hazardous communication training. The Silica standard spells out in particular that you have to address the cancer risks, lung effects, immune system effects, and kidney effects. And that you need to train your workers on health hazards, tasks resulting in exposure, workplace protection, who the competent person is, and the medical surveillance program. So all that stuff needs to be listed in your hazardous communication program that's dealing with silica. In Minnesota, this stuff needs to be given every year. Once you're outside of Minnesota, it's not always that way. With records, you always want to keep records of your training, number one, which is not listed there. Any kind of air monitoring data that you have, any kind of objective data that you got from manufacturers or got from some industry, and the medical records that deal with employees that have exposure to silica for more than 30 days a year. I should say that have to wear a respirator for 30 days or more a year. Compliance dates, basically everything is in effect. And so you need to comply with the Silica standards. Social enforcement is actively going around right now, taking a look at work sites. So expect a visit, be prepared for them. Here's some guidance and outreach assistance for you. If you go to www.osha.gov/silica, you can find fact sheets, other sheets, videos that will help you with training and monitoring and things of that sort. Actually, that's a good resource for just fact sheets on all kinds of other types of hazards too. So you want carbon monoxide or hexavalent chromium or ladder safety. The fact sheets are generally a page, 2 pages long. Real nice to have. There's some medical surveillance guidelines that are available. You can download the Small Entity Compliance Guide, which talks about the incidental use of the drills. That's nice to have. I would suggest to all of you to download that, print it off, and highlight the pages that basically say that, if we're drilling for less than 15 minutes that we're not covered. And you can subscribe to OSHA Quick Takes. A lot of the questions I get is, how am I supposed to know this stuff? I'm just a small guy. Well, if you subscribe to OSHA Quick Takes, they will actually send you stuff via email that tells you what's going on. And so that you can be up to date with what's happening. We have a separate one that we do here in the state of Minnesota. So anyhow,
well, thank you, Peter. We do have a few questions that are coming through.
Okay.
So one question that's been put forth is, what tools or devices can I use to measure my current exposure? Or do we need to hire an outside company to assess every single situation?
You don't have to hire an outside company. Measuring silica is not brain surgery. It requires a sampling pump, which is nothing more than a glorified aquarium pump. It draws air at a certain volume, and that's hooked up to a hose, and the hose is hooked up to a device called a cyclone. And a cyclone is basically spins air, spins it around, and The more dense particles fall out the bottom, and the lighter stuff or the less dense stuff is actually sucked into the filter. And then what you do is you take that filter and you send it into a lab, and they will tell you what quantity of silica is in there. Now you don't have to buy the stuff. I mean, you can rent it, and in some cases, people will send you the equipment for free. Um, the University of Wisconsin lab, and that's where I send my stuff into from the state of Minnesota. They will loan you the equipment. They will set it all up. You turn the thing on, shut it off, write the time and a date and how long the stuff was running, send it back to them, and they will send you a report on what your employee's exposure is. And all you do is pay for the analysis. So the pump and the cyclone and all that stuff is free. They'll mail it to you, you mail it back, you pay for the analysis. So other than that, like I mentioned at the beginning, is that your state consultation unit can do the stuff for you, and it's all free of charge. The problem is you have to wait. In state of Minnesota, we have like a 3-month backlog. So other states might be different. We have state plan OSHAs, and then we have federal OSHA. Federal OSHA covers about half the country, and states cover the other half. Minnesota, California, Washington, Iowa, South Dakota, Florida, New York, they have their own plans, so those are state plans. And that's only a partial list. There's like 25 states that have their own plan. So if you're interested, give them a call. It's their job to help you. They're not your bad guys. Consultation unit are the good guys. Their job is to help you make your place safer and healthier. So all you have to do is ask.
Well, that's great. I just want to remind everybody that to please continue to submit questions, and as time permits, Peter will help give us some guidance and answer the questions. We do have a few more questions. Peter, one question has come up is, are there any exemptions to the OSHA Silica ruling based on the size of the company or the number of employees?
No. If it's incorporated, then it doesn't really matter what size it is. If you're doing this on your own and it's a mom and pop operation and it's you and your son or whatever, it's fine. OSHA doesn't cover that situation. But if it's a corporation, then it would. So.
Okay. I see another question that has come up is if an installation company or a standard awning company has 3 crews that are doing installation, each traveling to different project sites, does each crew require a competent person to be designated as the train leader?
Yeah, you need to have a designated competent person, but that designated person doesn't have to be on site. And so the way that it would work is that the competent person is actually in charge of the site and to make sure that the employees are following the rules and are using the right respiratory protection program, using the tools appropriately, and so forth. And where it would come into play is if OSHA enforcement did show up, and if everything was fine, if there was no problem there, there'd be no issue with a competent person. But if they had trouble, they had violations, they would ask about the competent person and where they're at. The competent person is basically the person that can make changes on site and make adjustments to ensure that the rules are being followed. So to answer it quickly, yes, you need to have a designated competent person. No, they don't have to be on site.
Okay. Another question has come in. Is there any specific hammer drill with vacuum you would recommend
Uh, uh,
generically?
I can't recommend anything. I mean, I
Yeah.
when I was putting this together, I was going to put in some nice pictures of various manufacturers of drills and the stuff that they had. I'm going, well, I can't do that. So there's lots of good stuff out there. Every major manufacturer has hammer drills and vacuum attachments, and I suggest you go to whoever your supplier is and see what they have available and go from there. I mean, like I said, every major manufacturer has all kinds of things. I mean, if you just go to their websites and take a look, the first page generally is talking about silica, that we have tools to control silica exposure. We have this, we have that. So um, find one that you like and you're comfortable with and go with them.
Okay. Um, Another question. The question is, what are the fines and penalties for non-conformance?
Oh, OSHA fines. It depends on the state to start out with. In Minnesota, the fines generally range from $3,000 to $7,000, and then you'll get some credits on those depending on how big your company is. If you have a small company, you get like a 55% credit on your penalties, and then you get credits for certain things like not having a history of this going on in the past and having good safety and health programs. Uh, but those fines are per hazard item. And if you're chopping away with a chop saw and without any kind of protection at all, OSHA enforcement comes by, you might get 10 hazard items at $3,000 to $7,000 a piece. So yeah, it depends on the situation. Some states, federal OSHA has an egregious policy that if you have 10 different sites doing this at the same time, they'll cite you 10 times for the same thing. So we're actually nicer here in Minnesota.
um, and Peter, there's one question. I think you've really touched on this in conversations and in questions, but it's put forth. Are consultants or trainers available to help PAMA members with OSHA compliance?
Absolutely. Each state has a workplace safety consultation unit that their job is to help you. So all you have to do is ask. In Minnesota, you can call me up or send me a text message, whatever. I can help you out. Uh, you can call me up if you want. I mean, I don't look at the area code. When my phone rings, I don't really care. If it's something that I can answer, I'll answer it for you. I won't say I work for Minnesota, I can't answer your question because you're from Iowa. So contact your consultation unit. They'll be happy to help you.
Well, I think. Thank you very much, Peter. We are we are running out of time today. Thank you all for your questions, and please feel free to reach out to PAMA's Division Supervisor Andrea for more information on the division and its programming throughout the year. Once again, we thank you, Peter, and thank you all for attending.